We did this work on WNK2, which is a tumor suppressor in certain solid tumors, while we realized that in Waldenström is a different case. In fact, WNK2 is, first of all, upregulated in MYD88 mutated and CXCR4 wild-type patients, while it's suppressed when you also have the CXCR4 mutation. And there is something apparently unique, at least it's not described in the literature, for WM. And then we also tested different diseases, and we saw that in other solid cancers, this upregulation of WNK2 can happen as well. So in contrast to what is known so far. And this is the reason that prompted us to study WNK2, and that is when we discovered that there are different new isoforms of WNK2 that are aberrantly upregulated in WM, and they seem to be cancer specific. And so this is a very fascinating new rule for this molecule that we discovered, and we actually were able to validate. So this opens the way for new for also like a more isoform specific study, and also to understand how the same molecule in a different tissue and in a different cancer setting can have different functions. So highlight new potential novel therapeutic strategies. So we were particularly fascinated about WNK2 because WM is really dependent on ERK. ERK, in fact, is one of the pathways that gets upregulated in case of resistance to ibrutinib, and also is a very key pro-survival pathway because of its triggering of pro-inflammatory cytokines that support WM growth and survival. And we also confirmed by our functional study that this is the case in those forms of spliced WM. So this makes them potentially really interesting targets. But for what we have studied so far, those novel spliced isoforms don't have structures domain that we can directly target. So this is a limitation for us as of now to be able to target those specifically. But we conducted some preliminary studies on few cases right now targeting other novel isoforms that are also overexpressed, but they do contain a structured domain, so the kinase domain, that can be targeted with a drug that's been already developed and is commercially available. It was actually developed for a different type of disease, so for hypertension. But when we try to apply it and treat our mononuclear cells for these patients with this drug, we did observe a B-cell specific induction of apoptosis. So these are obviously preliminary studies, so we need to accrue more data and understand broader, but it seems that there is a little bit, at least of a space for the WNKs family to be a novel therapeutic target. And potentially, if that is the case, we need then to validate still if we can obtain the suppression of the ERK signal that we see at the functional level, and then moving forward, potentially thinking of it as an alternative in those patients that may acquire, for example, ibrutinib resistance. But obviously, those are all potential strategies we can imply, but we first need to accrue more patients and solidify somehow the data that we have so far on this new treatment.